My name is Pete Lozier. I'm the Executive Vice President of Provider Relations, Account Management, Sales, and Marketing for Europ Assistance Canada. Well, today I'm actually talking about the processing of healthcare claims around the world. What the challenges are, what the opportunities are, and really what the expatriate is looking for in terms of service. We're a facilitator, so basically what we do is we have relationships with providers all around the world, and we can facilitate the transfer of patients from one location to another for definitive health care. It isn't necessarily just Americans going outbound, it's individuals traveling from anywhere in the world, whether it's inbound into the U.S., outbound from the U.S., or inbound, outbound from anywhere in the world, essentially. We're a global third-party administrator, so for us, boundaries are inconsequential. The landscape of medical tourism is really changing by a number of ways, and I think what we're seeing is an overlap with the expatriate. Many of the hospitals that you see here at the conference are here for two reasons, or maybe even three reasons. They're here because they're looking for that medical tourism, the elective person to come to their facility in order to receive definitive health care. But at the same time, they're in the same locations as where expatriates are located. So Thailand is a perfect example. Thailand has a lot of expats that live there, Americans, Canadians, British, etc., that live there, and they go to Bumrungrad Hospital, whereas Bumrungrad is also looking for the elective patient to travel there. So the medical tourism, expatriate, health insurance, and the administrators and service providers around that are really starting to overlap, and I think that's why you see that happening at the conference here. Well, the value that the conference brings is bringing people together. And exchange of ideas, and the various both service providers as well as purchasers. The world of healthcare is constantly in flux. We need time to come together, exchange ideas, network. A big part of this conference is relationship building and understanding what services are available. So I think that's one of the big parts of the conference that it brings is the ability to network with your peers from other locations. This is not my first. I've actually been here since the very first one, so this is my third. I think this is the third Congress, and so I've been to all three, including some of the regional ones. This year, the quality of the attendees, significantly different this year than I found over the past couple of years. They're going in the right direction. There's more purchasers here, there's more brokers, there's more employers, there's a wider range of service providers. At the beginning, it was really overwhelmingly hospitals from different locations around the world, which is good. You need those providers. And also a number of very small people that were getting into the industry. They were trying to, the industry was in its infancy, but it's matured, and so the conference has matured. Well, again, I think what they should continue to do is what they're doing now, is they're expanding, expanding the footprint around the world, but also expanding the scope of what it is that they're talking about. The combination of medical tourism, expat, travel insurance, self-funded programs, these are all related. These are all healthcare issues. So expanding the scope, which is what they're doing, is what they should continue to do. Well, Europ Assistance is a organization with about 39 offices around the world, headquartered in Paris, a wholly owned subsidiary of the Generali Group. We are the founders of and inventors of Assistance, and Assistance really to us in the medical component in Canada is, again, taking patients from one location to another to get definitive health care and being able to pay those claims on behalf of a insurance company, government agency. And that's with the whole, basically with that entire episode of illness centered around the patient and patient advocacy. We have a motto. We always say, if you can take care of the patient like they're your family, and you take care of the funds like it's your own, you're probably heading in the right spot.